Are you experiencing low back pain? Well, it wouldn't be surprising if you were, because up to 80% of people will experience a low back pain episode in their lifetime. Hi, guys. My name is Dr. Jeff Ajazi, and I'm here at Back to Wellness Chiropractic, and I'm here to share some basic facts about low back pain. The good news is that the majority of low back conditions can be treated through chiropractic care as well as other conservative therapies. Even though most low back conditions can be treated conservatively, there are some diseases and pathologies that can manifest in low back pain. If you have associated fever, weight loss, severe trauma, or loss of bowel and bladder functions, those are pretty serious red flag signs to get checked out, and you're definitely going to want to get checked out by a medical provider. But in our office, we are going to do a detailed history and an exam to really hone in on an accurate diagnosis so we can really determine what the best treatments are for you. In our office, not only do we incorporate chiropractic adjustments, but we're incorporating in what the science shows is the best on the guidelines of how to deal and treat back pain. So we're integrating in soft tissue techniques, corrective and rehabilitative exercises, in addition to chiropractic care. Before I come in and start the exam, the girls are going to get you back into the examination room and get your vitals. I also wanted to point out that we do have an x-ray machine in-house if there are any red flags, trauma, etc., that would indicate any type of x-rays. All right, so I have my son Gabe here, and he's going to help us demonstrate an exam and what a treatment looks like for low back pain in our office. Once we've ruled out the red flags, gone through the detailed history, and once we get to the exam, we start with just a good old orthopedic and range of motion exam. So go ahead and stand up for me, Gabe. I want you to stand on this other side of me here. I want you to go feet together. All right, and if you have any pain or discomfort standing here, that's your baseline. And then as you bend, move, and twist, you just let me know if it increases your pain. So try to touch your toes. Okay, come back up. Lean back as far as you can go. Good. Back to neutral. On this direction, you can kind of see with Gabe, he was really hinging really right at his waist and didn't really have a lot of range of motion through the mid-back. His range of motion looked pretty good there, but that's something we're really looking at is for fluid, smooth arcing range of motion, not only just can you go as far as you can go, as well as does it hurt or not. All right, Gabe, face towards me. Face towards me now. Now we're going to do side to side and see if that bothers you. Okay. Okay, now twist, twist. Okay. All right. Assessing for, does it hurt? How far you can go? Is it within normal range or not? Have a seat. If it is limited, by how much? This is when we would go into the neurologic aspect of the exam, where we would do reflexes, test his muscle strength, look at sensory, if he's lacking sensory sensation in some of these areas. Just to save time, we'll kind of bypass on what the neuro exam looks like, but this is where we do the neuro exam. Then we would start going into some orthopedic testing, looking for any kind of serious forms of radiculopathy or sciatica. So go ahead and lie on your back, Gabe. Doing a very classic test here for low back pain. Asking, okay, does this hurt? If it does, where? Is it shooting down your leg? Is it causing numbness and tingling? Go ahead and do a big setup, Gabe. Seeing if that hurts or bothers him. Okay, Gabe, go ahead. Now we'll do some other classic tests that help really determine what can be contributing to some low back pain. So scoot down to the edge of the table here. This is called Thomas test. And what it's looking for is hip flexor tightness. So what I want you to do is let's go ahead and pull this left leg up towards your chest nice and tight, and go ahead and lay back. And what we're doing is we're looking at this right leg. Let everything just let it go, Gabe. We're letting everything relax and trying to see, is his leg coming up off the table, which would indicate a tight psoas muscle, which that one looks okay on Gabe. But the fact that Gabe's leg is extending out past 90 degrees of his thigh, that really indicates a tight quad. So on Gabe, just doing this test alone, we would be looking at what we need to do to try to help loosen up Gabe's quad. So we, of course, do both sides. Come on up. Once we started looking at some of these basic orthopedic tests, we would start going into palpation. So let's have you go face down. So we would be feeling around for stiff, tight joints, tight, spastic, knotted muscles. We would be looking for and asking for if he's having tenderness when we were pushing around on these areas, which would correlate to his back pain. We would be also looking at other aspects of range of motion, which could help indicate reasons and the real underlying reasons of why he's having some of his issues. Once we got through some of this initial part of the exam, then we would start transitioning into our repetitive movement assessment. In our office, we incorporate a concept called MDT, which is very big on repetitive movement assessment to try to help us understand the mechanical aspect of low back conditions. So every condition can start in a different spot with repetitive movements, and it all depends on the history. But just to show you kind of a basic start point, where we would start is go on your back, Gabe. Bend your knees. Pull them up a little bit more. So before we start doing any kind of repetitive movement assessment, we always establish a baseline, asking Gabe if he has any kind of pain, tightness, discomfort associated with his symptoms laying here at this point. Then we would have him do, in this case, 10 knees to chest movements. So pull your knees towards your chest with your hands and scrunch into a ball and really pull in, and then feet back on the table. And then we would do this 10 times total. So he's not going to have to do the full 10, but he would do 10 total. And then at the end of the 10, we would ask him what has changed during those movements. And then after, now that you're done, how have things changed? And of course, if anything is worsening during and after, that's when we determine, okay, these are not good movements for Gabe, and these are provocative movements. And then what we're trying to look for are the movements that can relieve his pain and symptoms. So go ahead and go on your stomach now. So another very common repetitive movement that we will look at is extension. So once again, reestablishing his baseline, asking him if he has any symptoms laying here in this neutral position. And we would have him put his hands in push-up position. And you're going to do a push-up with the upper half of your body, Gabe. So push up. Asking him when he presses back, does he have any increased symptoms? I'm also looking for range of motion. If he has limited range of motion as he tries to go through this movement, go back down. And of course, he would do this total of 10 times. And I would ask him, go ahead and just give me a few, Gabe. I would ask him as he's going through these movements, and then once he's done, how is his lower back symptoms changing, if at all? There are multiple different positions, forces, directions that we can work, but these are just some of the most common ones when we're really looking at a repetitive movement exam. And it really helps us shed light on truly what is mechanical and what is not mechanical back pain contributing to his issue. So most people know that if you have a weak core, it will absolutely contribute to low back pain. But if anybody's ever experienced a low back pain episode, they will know that they definitely do not want to be doing core exercises while their back is hurting. So once we've gotten you past your initial phase of care where things are more acute and tender and painful, and it's a little bit easier to move, we start quickly transitioning into rehabilitation and corrective exercise to really stabilize your lower back. One and the first thing we look at is how you're breathing. You might ask yourself, how in the heck can my breathing affect my low back pain? But trust me, the research is out there. One common test that we will look at that can really help us look at this issue is this guy right here. Gabe, go ahead and put one hand on your chest and one hand on your stomach and just take in a couple of breaths. What we're looking for is how his hands are moving, like which hand is moving first. Ideally, what we want is to see his bottom hand moving up and down, which would indicate that he's really filling up his abdomen with air and using his diaphragm, which is the major muscle for breathing. Most of us in this day and age breathe with our chest and not with our diaphragm. And what we'll see is that most people will lift their hand on their chest as the one that's doing most of the moving, which would indicate they're using more of their chest and not their diaphragm. So if that's the case, then we start just initially sending them home with just this one breathing exercise to start getting control of really tapping into the diaphragm. And that exercise is, Gabe, I want you to get in this position, take this guy home, and I really want you to emphasize on really filling up your tummy with air and really taking big breaths where you really mainly feel this bottom hand moving up and down when you're breathing. So go ahead and give me some big breaths, and I really want you to see that bottom hand moving up and down. Good. That looks much better. Now, once Gabe gets better control with this, then we can start progressing him into other more challenging positions and exercises using this same breathing and pressurizing concept. So, Gabe, now I want you to fill up that tummy with air and try to keep that there. So, fill up that tummy with air and hold that pressure. Breathe, lift your legs up. Now, feet above your knees just a little bit. Good. Now, I want you to put your hands up in the air. Now, keep your pressure and keep breathing. This would be the next progression. Then we can try to start having him keep that pressure, bring these arms back all the way, and then back up to neutral. We can have him do his legs. And these are just different challenging progressions that we can teach him to do as he's really tapping into really using his pressure in his abdomen. Gabe, go feet down. If we don't have proper pressurization in our abdomens, that's when we can really collapse and fall down and get vulnerable to lower back tweaks and injuries. Think about it like this. If I had an empty pop can here in my hand and it was open with all the fluid poured out of it, and I put it on the ground and I stood on it with my body weight, the whole can would collapse. Versus if the can wasn't open and it had good proper pressurization and everything was closed. If I were to go to stand on top of that can, I could literally stand with my own body weight on it without it crushing and collapsing. Same thing here in the abdominal cavity. If we don't have good proper pressurization in our abdomens, everything will collapse in and crush down in on the spine, and that's what can create low back injuries and develop low back conditions. And we have to tap back into this to create stability to prevent these issues from happening.